Hello friends, this is Dr. Abdul Mubin A. Mundewadi from Mundewadi Ayurvedic Clinic. In today's video, we will describe the Ayurvedic herbal treatment of Meniere's disease. Now, this is a disease in which in the inner ear there are semicircular canals and there is fluid inside that, and disturbance of the fluid in these semicircular canals causes a loss of space, a loss of balance, and leading to vomiting, severe tinnitus, and gradual hearing loss in the patient. Now, this Meniere's disease can be quite incapacitating and may cause a patient to completely be bedridden for several weeks together, and the patient is not able to get up or control his balance and orientation, space orientation, and this needs to be treated as early as possible, because initially along with that there is temporary hearing loss, but in the long run this hearing loss can become permanent. So this has to be treated quite aggressively. Modern treatment gives medicines which control vertigo and vomiting, but does not treat the root cause of the disease. Ayurvedic herbal medicines are very good in the sense that these can treat the root cause of the disease. Herbal medicines are given to treat all the symptoms, the loss of balance, the vomiting, tinnitus is there, there are abnormal sounds in the ear, and along with that medicines are also given to control the hearing loss and to help bring back the inner ear to normalcy as early as possible. What happens in this disease is that the fluid which is there in the semicircular canals, this becomes thick and it loses its fluidity. Because of that, there is a dysfunction of the sensory perception coming from the inner ears to the nerves. So this needs to be treated as early as possible with the help of Ayurvedic medicines. Normally around 6 to 8 months treatment is sufficient for most patients to come back to complete normal. And if the medicines are tapered gradually, then there is no recurrence of this disease. In a few patients, Ayurvedic Panchakarma may also need to be added. But this depends upon a patient to patient basis. We have to decide where it is needed, what Panchakarma is required. So all in all, about 6 to 8 months treatment of oral medication, sometimes combined with Ayurvedic Panchakarma therapy, are required and are quite sufficient to treat this Meniere's disease, which can be quite incapacitating and can lead to serious loss of quality of life. So friends, this is a short description of Ayurvedic herbal treatment of Meniere's disease. Let's meet in the next video. Goodbye.